MedPark Hospital has set a clear objective, bringing together the best Thai medical personnel to provide comprehensive care to patients using its integrated care concept that the hospital aims to become a leading medical center in Southeast Asia. Among the newest of Bangkok 150 hospitals is MedPark, which was opened by Mahachai Hospital Group in 2020. After 30 years of operating hospital in Bangkok outskirts, MedPark launched its flagship projects in the new business district of Lamapho Road 2 years ago. MedPark Hospital aims to become a regional center for integrated healthcare, serving patients from all over Asean in the heart of Bangkok. It also supports education, research as a part of its mission to become a leading hub for medical treatment in Southeast Asia. And right now I'm with Dr. Pongpat Pathanvanit, Managing Director of MedPark Hospital. สวัสดีค่ะ Dr. Pongpat
สวัสดีครับ
First of all, I would like to know what is the history behind MedPark Hospital.
The MedPark Hospital we opened since October 2020. Before that, the Mahachai Group we have almost 6 hospitals in Samut Sakhon, Samut Songkhram, and the nearby province. We have a pain point that when we have sophisticated patients and we need some equipment, medical equipment to investigate, but we have limited to invest in the rural or suburban area. So we need to send the patient to Bangkok to the big hospital. And when we send the patient there, sometimes it's not convenient for us. And the patient is not familiar with the big hospital that is not the same group of us. Sometimes they suffer when we refer it. So we plan ourselves many years ago that we need a flagship hospital in Bangkok. So we find the solution that we go to see the many hospitals in United States. And we find that if we want to make a flagship hospital, that is a referring hospital from other hospital, what we had to do. So we plan to make the hospital that can support the sophisticated disease that need to transfer from other hospital in the suburban area. And when we plan this, we find the land, the location, and we got this area that is the land of the Crown property that come from the TCC group that give us the opportunity to make a new hospital here.
Right. MedPark opened its first phase service in October 2020 with an investment of 7 billion baht. But the project of 10 billion baht for total is a 3-year investment to provide services with a staff of more than 30 medical specialists and 350 highly qualified physicians. The hospital also specializes in treating difficult or complex cases, including patients with multiple diseases that necessitate care for several specialists at the same time. And what is the strength of the MedPark Hospital that differentiates from other hospitals in same industry?
Because we are coming late from other hospitals. Every hospital that being built 20 or more than 20 years before us. So we know that what is the problem that the hospital building have. What is the problem about the management of the hospital for the doctor and for the health personnel. Plan and design by doctor. That's they have knowledge what they want. What they think their patient they treat want it. So this hospital designed by doctor.
From their experience, right?
Yeah, from their experience and their pain point with the old hospital that they have been there. If we do the biopsy, the pathological result will be send back to the doctor and the patient within 1 or 2 days.
Oh, very quick.
Not to wait 1 or 2 weeks as before.
Yeah, right. It's very quick time that the patient can know the results in the short time as well. And I have known that here is like a school. MedPark Hospital was established during the COVID pandemic. Many people saw the pandemic as a barrier to doing business, but hospital leader Dr. Pongpat Pathanwanit see it as a chance.
So we asked them to join the project that how can we help the country to do the vaccination.
Why Dr. Pongpat have like this concept?
I think if we think everything as an opportunity, we can find the way to go. And also, you know, in the medical professional, if we make them as a giver before taker, you will bring them to be more kindness to the people. If we have like this, it means that the people will accept you as the one who take care of them, not because they want your money.
And does MedPark plan to expand the business to be the world healthcare destination in Southeast Asia in the future?
Yeah, sure. This is what we plan, is that the MedPark Hospital is not a competitor to other hospitals in the previous in Bangkok. We want to join hand to hand together to make us Thailand competitive to other countries, especially in Singapore. That as I know, the case going there is a sophisticated disease more than to Bangkok, to Thailand. So how can we move that?
Right.
We had to concentrate ourselves to the sophisticated disease. And I think other big hospitals had to join to this too. And during the COVID, make us have a lot of debt. We had to help our country to find more income to
the country. Last question, ka. What is the MedPark direction for standing for overall in the healthcare business in Thailand?
I want to tell the health industry that if we move this way, we can provide ourselves. Even the government have direction definitely or not, but we ourselves go this way to make opportunity for Thai doctor to competitive in Asean. We can treat the medical destination here for all the patients that sophisticated disease in Bangkok, in Thailand, in this region.
And today, Business Story have to say thank you to Dr. Pongpat Pathanwanit to join with our program. And thank you very much, ka, Dr. Pongpat. Dr. Virat, what is a strategy for IPD and OPD patients once COVID-19 become endemic?
All the people who is vulnerable when they get infected with the COVID, such as the people who has an underlying disease, such as like kidney, heart, lung, or cancer or immunosuppressive agent. This group of the people is very vulnerable. When they get infected, they will be very, very sick, and the mortality in this group is quite very high. For this floor, on the third floor here, we have the hemodialysis, which is we decided to have the separate bed for each patient for the dialysis, which is helping the people for the dialysis patient, because normally in the dialysis unit, when you get into the dialysis unit, you see a whole bunch of the dialysis units and patients all gathered together. Once the COVID infection is get into that unit, mostly they spread it out in that unit, and these people has a troubles because they cannot find a place for their dialysis, and also the good people who didn't get infected cannot get the dialysis as well, because they had to be quarantined, had to be isolation. That is a big problem in this group of the patients. And we decide to have this dialysis unit, which is separate bed, So you can see that in each bed stay in their own unit. So we can separate the infect patients and prevent the infections. Yeah.
Yeah.
For the IPD, we also decide to have the negative pressure room
right.
for each room, that when the patient is in there for the COVID, that will helping to make sure that everyone is safe in our hospital, including the staff, including the non-COVID patients, and also the COVID patient as well.
Dr. Virat, what's laboratory for?
This room is a laboratory. It's a point of care service that we provided just to get a rapid response and result, when the people come in to get the COVID testing. So if anyone who come into the hospitals and want to or have some symptoms that we are not so sure whether they are contagious or not with the COVID, then we need to screen them first before that we let them into our buildings. Otherwise, it won't, safe for everyone. As we know that, the COVID pandemic is an unprecedented, spreading of the virus that we never seen this before, and changing everything. And then we have to concern for all parties that in working with us, including the staff, including the patient, who is a good patient, well patients, and also the sick patient as well. So that's why we set up this screening area that we can screen for the COVID first to see if they contagious with the COVID or not. If not, then we'll allow them to get into the hospital building. If they're contagious or infected with the COVID, then we have to treat them here upstairs with the doctor to see them, and we decide to using this all the point of care RT-PCR. That we have like the machine from 2 different company that we get the result in about 20 to 30 minutes. And we know that these persons are infected with the COVID or not.
Oh wow! Yeah. Only 25 minutes.
Only about 20,
can know the result.
minutes. Yeah,
it means like this laboratory show is a first screen before go to the hospital.
That's correct.
Right?
That's correct. This area is a one-stop service for the COVID patients, who come in and they can have the examination room, and pharmacies, and the cashier, and the X-rays. So everything that can be done here, one-stop point of care. Yes.
And all the room designed for negative pressure, right?
Right. We designed it for the safety. We separate it into compartments with the positive pressure and negative pressure area. The negative pressure area is where the patient will stay, and the positive pressure is the doctors and the staff gonna stay. In this area, we have the X-ray, so we can get it done over here when we need it.
This is a X-ray machines.
Yeah, this is the
for screening.
Yeah.
What is the future direction of MedPark in terms of the medical treatment to provide to the patients?
Well, we intend to be a hospital for the very complex disease, and in the meantime, we know that the healthcare industry is not the technologies.
Yep.
It is the service sector.
Right.
Basically, the technologies, all the devices that we're talking about, these sophisticated machines, it's just one part of the way to take care of the patient.
Right.
But the real care of the patient is the human touch. Human care is the service sector. That's why I believe that we need to creating the environment that the healthcare workers, who has take care of the patient by heart, and in the meantime we need to support to creating and generating the new generation of our care worker as well. We intend to put our hospital to the next level by try to creating a postgrad training that can be trained the doctors. So once we have these good and well-trained doctors, it can be reassure our sustainability of our success in terms of not just only for the hospital, MedPark Hospital, but for the Thailand, because if the Thailand gonna become a medical hub for the world,
Right.
we need to find a way to make it sustainable, not just only the facility, but the people, which is a human capital, is also very important as well.
Right. And for today, thank you very much for joining our program, and thank you for taking us to see around MedPark Potential today. And MedPark Hospital is now busy building a reputation as a treatment hub for both Thai patients and those from other Asian countries. The aim is to make Thailand a regional medical destination whose treatment of complex diseases compete with any country in the world.